This is a more complex one. I'm not going to take you through all these circles, but it does depict, it's from a recent policy brief from ODI discussing the topic of early recovery. It's a kind of a mechanism between humanitarian work and development work, and do something of both, which is a notion which came on in our world, which is a bit problematic. So that's why they were writing this and developing this. But I think this is what you see. You are kind of, you're halfway, you're doing humanitarian work, you're somehow being in stabilization, although that has a bit more military notion. But then you're also caught in state building, development, peace building. So where are you? What do you have to do? To what agenda does your health work fall into? Okay, this may all not be so bad. I'm not sure if it's very bad, but I think it does come, and at least for me as a health professional, and I have been working and will be working in some of those areas, comes with a degree of discomfort. And I think the health for health ethic, I think that is what drives us. Once you get into the medical profession, I think you're strongly bound by that ethics. And of course that's the oath of Hippocrates. But also if you're more in public health, the oath will say, okay, you help individuals who, irrespective, that comes first. In public health, I think that's kind of translated into a strong notion of promoting health equity. And what I think you see that, and then use those terms like securitization and politicization of healthcare. So healthcare being used to win the peace, or to the military will use it also to protect their goals, whatever you think of those goals. So it's not necessarily bad, but it's what does happen. But even if you do peace building, quite benevolent peace building through health, you get into, you politicize health. By nature, peace building is a political process. If you use health for that, you politicize health. What I think we start seeing already, and this may be increasingly the case, but it may need some more research, but funds for health are to a certain extent driven by these agendas. There's much more money going to certain parts of the world where there is a security concern from the West, or within countries. I've seen it as well. A quite famous example is Sudan, Southern Sudan, that we had entered post-conflict, and the US government, they were focusing not on health as for equity reasons where health was most severely affected, but in those areas where they felt, well, this is the kind of areas which are most important in terms of lasting peace. That's why they wanted to invest in health. That, to exaggerate a bit, but I'll have a great quote from someone on the next slide. A bit is the question, are we becoming soldiers? And I don't mean you signed up for the, if you haven't seen him yesterday talking, he is working with the Danish army and in the health sector. But as a health professional and signing up for the army, that does come across with quite some often serious moral dilemmas, but that's what you sign up for, and you have to somehow deal with that. I think also if you are sign up to become a civil servant, you sign up to what your government wants you to do. That's the rules, and some governments want you to do things and others. But quite a few others of us who are working in NGOs, in the UN, as consultants, we seem to get drawn into that to a certain extent. And for me, that was a bit of the case. I have been working in that capacity in a number of different roles inside Afghanistan for quite a few years, and trying to, of course, with this health promotion agenda in my mind, but working quite happily, I must say, with the Ministry of Health in Kabul. So I've been part of that machinery. And it's only recently that I saw Dr. Fatimi quoted from an interview. And Dr. Fatimi, he's very much a health professional. I mean, he, of course, as a minister, he became a politician as well, but he had very much that health efforts and wanted to promote health for his population. So he was quoted along these lines: "I do believe that health is at the center of socio-economic development of Afghanistan." Yes, that's really something we health professionals do believe in. Economists usually don't. But health is a bridge to peace. Health is a corridor for tranquility. Even the animals, receive the health services in our facilities. That is why our facilities are there and deliver health services. And it continues. So that is why we can promote peace. We can convince the ones that are confused to take the side of the Afghan government. And yeah, I think we also changed our mind a bit. I mean, we thought in the beginning, like post-2001, we were a bit more convinced that there was an emerging good governance in that area. Maybe not fully legitimate, but okay, elections and stuff. But these is, of course, as you've seen from the last election process, there can be really some queries about the legitimization of that particular Afghan government. So I think that highlights a bit the kind of problems I want to raise. So then I was asking kind of these questions. Should health professionals not be more aware of this potential use of health for political purpose? It's sometimes quite insidious. You're not directly hired to do something, but I may be hired by USAID to work in Kabul. That's already slightly different, but I also might be hired by the EC. And where are they? Somewhere. It is difficult to exactly gauge where they are, but you are part of that machinery. Should we develop a framework a bit similar? I mean, I'm sure we cannot use the same clear principles as the humanitarians have developed over time, but you need some other framework, some principles to guide you. I mean, by nature, this kind of work is not neutral because you want to sign up to a government, you want to have a better governance in a country because that's good for health. But when do you kind of cross the line so that it may help you to provide some guidance for you and for your organization? And then, I still think should a health profession, it needs first and foremost be more active in pursuing really health for health so that health investments are done in the most equitable way. So for those ones who need it most in the world. These are my questions.
Thank you.